So good morning, everyone. This is a phenomenal day, not only for Navicent Health, but most importantly for the community that we serve. One of the top community health needs of this community is the care for the diabetic patient. It is an honor to be here today to talk about the new ConnectWell program. 100 diabetic patients who receive care at the Family Health Center, which is our center at Eisenhower Parkway, will receive an internet-ready tablet equipped with an unlimited data plan. The patients will be able to monitor their diabetes from home and then interact with their primary care physician or whoever their clinician is, readily and when necessary. One of the key themes that we talked about all the time, particularly here in the community that we serve, is the ability to have access to great care, make sure it's affordable, but equally important that it is equitable.
As a practicing physician for over 20 years, I can honestly say that any resource that helps patients manage their own care would definitely be preferred by both the patient and the care providers. By linking internet connectivity with healthcare, we're preparing rural and low-income patients for longer, healthier, and happier lives. Please join me in welcoming Mr. Kenneth Cutts.
Thank you very much, and good morning. I'm happy to be here on behalf of Congressman Sanford Bishop in our 2nd District Congressional Office. The ConnectWell program will directly connect 100 low-income diabetes patients with their health care providers via a high-speed internet connected care management platform. It is based off of a similar and hugely successful project that was conducted at the University of Mississippi Medical Center, which dramatically reduced hospitalizations and emergency room visits.
At this time, we'd like to turn the microphone over to Mr. Brian Cavey, who's the Senior Vice President of Government Affairs for CoBank.
39% of our rural communities, our rural residents, don't have access to the broadband services necessary to run this program and to provide quality of life enhancements. So programs like this have the very real potential to improve those healthcare outcomes and potentially manage healthcare costs effectively as well by making available the broadband service on which this technology depends and the technology that helps it operate.
Mr. Agu serves as the CEO of EveryoneOn, a national nonprofit dedicated to closing the digital divide. To date, EveryoneOn has connected over 500,000 low-income Americans in 48 states to the internet and to the opportunities that affords.
We are using the power of the internet to improve people's lives and literally save people's lives. Let me just start off by thanking Navicent. Let me start off by thanking CoBank. Let me start off by thanking our partners at Robin Health, because they are the partners who are getting this done. You've heard about ConnectWell and how we are using the internet and the hardware that EveryoneOn is sourcing to apply the Robin Health platform to Navicent's patients. We're going to use the internet to change people's lives and improve their health care in the communities that need it most. And I quite honestly think that ConnectWell is going to be a model for the country.
Now it's my pleasure to introduce Anshu Vaish. Mr. Vaish is the CEO of Robin Health, a company that created the platform that we'll be utilizing for this new service.
My name is Anshu Vaish, and I am the head of Robin Health. And we're so excited to be here with all of you. So thank you. What is Robin? So Robin is a next-gen patient engagement platform that blends telemedicine and remote monitoring to enable providers to deliver and patients to access high-quality care anytime, anywhere. If we don't solve that initial foundation of patient engagement and getting them involved with their care and having them have access to the resources to be able to have that effective involvement, then everything that we build on top of it is not going to be as effective as it can be. And the fact remains that in a clinical setting, when patients are with us in our office or in our hospital, we do a great job. We can get them the drugs they need. We can execute the care plans that we want. We can have them take their blood sugar whenever we want them to do so. But when they go home, where they spend the majority of the time and the majority of the time that we want them to spend, it all breaks down. And so how do we solve that problem? How do we alleviate that issue? Imagine a world that every patient can spend 3 to 5 minutes a day engaging with a simple-to-use, interactive, intuitive platform to record and relay key health metrics, not just across diabetes, but all of their conditions. Because just because we have service lines doesn't mean patients fall into the clean service lines. They've got a whole ton of different things that's going on. And we got to make sure that we design for that, because it's all about keeping the patient at the middle of everything that we do. So imagine if the platform automatically triaged those patients and really bubbled up those patients that actually need the care at that moment in time, so that clinician time is more effectively spent and costs are overall driven down. And finally, imagine if those same clinicians and those same care management teams could close the loop and meet the patient where they need to be met, whether it's through a simple text message, whether it's through an audio call, or whether it's through a full-blown video conference to maintain that same level of relationship that a patient may have to travel 75 miles to achieve. With all of our partners here, we can create something that's going to be an example not just for Middle Georgia, not just for Georgia, not just for the region, but the entire country overall. And there's an old proverb that I'd like to close with that I think really encapsulates what we're trying to do here. It goes, if you want to go fast, go alone, but if you want to go far, go together. And for us, that's exactly what we intend to do.